Yes, I do.
Bryce, very good. It's so great to have you here. If you wouldn't mind, maybe start off by introducing yourself. Tell me who you are, where you're calling from.
My name is Bryce Boucher. I'm calling from Epping, New Hampshire, and my dogs are loud. I'm sorry.
That's quite all right. Well, Bryce. So we have some backup there. Who do we have in the house with you there?
Yeah, my wife Irina is here, and also on the line is Tony Zlackett, who is the mother of Jeff Boucher, who is the person that we are interested in using the Motus platform.
Sure. Okay. Sure. Yeah. I guess. Also, give me a little bit of background. Yeah. Tell me sort of the experience.
Jeff has had a brain tumor for about 14 years, and in the past several months, it turned to glioblastoma. Very serious. He had a craniotomy, which removed a lot of the tumor, but it's still in a grave situation, I guess you'd say. But in the meantime, as part of this surgery, he has some pronounced weakness in his left hand and left leg, and he has ataxia, which prevents him from doing some of the things that he would like to do with his hand and arm. And we had him in physical therapy and wanted to keep him in that, but he's so tired from the radiation he's been taking and so forth, and he's had such headaches, it's been difficult for him to do it. And so I happened to see your thing. I thought it might be an opportunity to try something different. He loves video games and so forth, and I thought maybe this is an opportunity to see something that could give him the help he needs through physical therapy, and also be something that would be interesting enough to him to keep him engaged.
Sure. Well, thanks so much for that, Bryce. And is Jeff there with you right now? Because I can only see you.
He's actually sleeping. I can try and wake him up, but he's
no need.
Peacefully sleeping, and I hate to bother him.
No, Bryce. No need at all. It's just one of these things that with video, it's hard to know who all's there. And so I just wanted to know if he was there. I could just address him.
I can't see you. I just see a screen.
Oh, okay. Well, I'm here.
I don't know if you can see me or not.
I can see you just fine, Bryce. Yeah, you actually are probably seeing someone playing one of the games right now.
I'm seeing a game being played.
Yeah, that's exactly right. Yeah, this is one of the games. So
they appear to be doing pretty well from the looks of things.
Yeah. This individual is doing very well. And I'll just remind this individual that when they need to take a break, they can just press the pause screen. But that's just a quick reminder. But I do really appreciate that background, Bryce. Very, very helpful to understand kind of where you guys are coming from. And so what I always like to do to frame these conversations is say, in terms of the evidence, I always start from the evidence and then I build upwards from that point on. And so with respect to individuals with GBM, I think, unfortunately, we don't have any data with regard to the Motus hand or the Motus foot's efficacy for those individuals. We spent the better part of 15 years studying individuals with subacute and chronic stroke. And that has been our primary indication for basically ever. And that is where we have our class 1 designation from the FDA. And so we have to be very careful. I have to be very careful to say with any degree of certainty that this could help someone with Jeff's sort of situation. And so that's always the baseline condition. I always like to acknowledge where we have data, where we don't have data, because I don't want us to have to draw incorrect inferences about things. So with that, though, when we
May I add one other thing?
Sure.
Very quickly. During his surgery, he had a stroke that actually may have turned out to be a fortuitous thing because it cut off the blood supply to a large part of the tumor.
Okay.
But in thinking about this, I think his disability is due to the operation, but it is possible that it might be due to the stroke. So I don't know if that really makes a difference. I mean, it is what it is that he has to deal with, but just as a
is it possible to turn off the game? It's kind of distracting to talking to you. Is it the doctor some kind of?
Yeah.
Yeah, let me ask my video and audio engineer to help with that. I'm sorry about that, guys. Is that better?
Yeah.
Very good. Okay. Well, if this is the first time that you're seeing me, it's great to see you. And I think in terms of the that additional information that you gave me, Bryce, helpful, very much so. I think it's good to understand it as well. I think my my guidance, my foundational sort of starting point is not going to change, though. I think individuals who have strokes secondary to brain tumors, those individuals are less frequently studied. And while the brain tumor and the surgery may be the incipient event, having the post-surgical stroke is likely to cause a lot of those problems, the movement impairments. That being said, even still, we don't have data on individuals who have had that sort of comorbid conditions. So this sounds like a very defensible position that I'm in, but that's okay. And I think what I like to do from here is to build up into some rational next steps for you guys. And that is, when you think about the process of neuro-rehabilitation, you look across the span, individuals who have had strokes, individuals who have had traumatic brain injuries, even individuals who've had spinal cord injuries, or even post-tumor resections. A lot of them have very similar sort of movement impairments. And the nice thing is, despite the fact we don't have evidence across all of those individual, what we call diseases or etiologies, the treatment approaches are very much conserved. And what I mean by conserved is they're very, very similar across those individual cases, in which case we're trying to either help someone improve their range of motion, strength, and volitional control of their upper extremities or their lower extremities in the case of walking or gait. And so with that being said, a lot of these approaches like robotic-based repetitive task practice-like programs could be very useful. Now, I think it is important for us to acknowledge that individuals with Jeff's diagnosis have sort of a different type of long-term trajectory than an individual who has maybe a stroke where that's not evolving per se. And so I think it's important to just keep those sort of points in our minds and acknowledge them when we're thinking about what we can have as an expectation for rate of recovery. So that's something that we just need to acknowledge. But when it comes back to first principles of neuro-rehab, these approaches could be very applicable to helping Jeff, improve his sensorimotor function, such as improving the ataxias that you're talking about with his upper extremity that might be impairing him from being able to, let's say, successfully negotiate, eating or drinking actions, ADLs, or even just general functions like dressing, these sort of things. So I think that would be my first level of sort of comments on that. And I'm just going to ask if you guys have any questions on that before we continue.
I do.
Sure, go for it.
So hi, Irina Bishay. Is that device, is it working in with occupational therapy? Because if you don't have muscle, doesn't matter how much brain or whatever your device sends signals, if there is a muscle atrophy, it's not going to work because there is nothing to contract. So where we are with that, is it like, do we need occupational therapy or just a magic thing that will fix everything?
Good question. Let me say, this is not magic. This is neuro-rehabilitation. Mm-hmm. And when it comes to the process of repetitive task practice, this actually works both elements. So you can imagine central changes and peripheral changes. Central being in our central nervous system, mm-hmm. and peripheral changes being at basically anything past the blood-brain barrier, things like our peripheral nerves, things mm-hmm. like our neuromuscular junction and our muscles themselves. Mm-hmm. Now, when we evaluate how a program like this can operate, it can actually induce changes in both ways. We've looked specifically at the brain components and how it actually will change the way that the cortical structures are communicating. We do some complicated math and we do MRIs. We can evaluate specific areas and how they're communicating. And we know that those changes can be very positive after a 3-month period. That's an independent study. Outside of that, we look at the effects on our function, sort of how much movement we have, how strong we are. And we know that after kind of a 3-month epoch of using those systems, we do see improvements in those measures. And so, but to be very, very explicit here, you're exactly right. If there is no muscle there, and I'm taking it to the extreme, if there's literally no muscle there, that means that the brain and the nervous system has nothing to communicate with the external world with, in our case for movement. So in that very extreme case, you're exactly right. There wouldn't be anything really to improve in those cases without having the brain connected to a robot that it can control by itself. I don't know if that's the case here. It doesn't seem like that's the case. There might be some significant atrophy just because of the lack of movement and potentially because of the lack of control. Actually, what's really interesting, without going into too many details, if you have a neuron that has a communication with a muscle and you damage that connection, what's really interesting is that both of them actually rely on each other. There are reciprocal relationships between those two systems that depend on each other. And if you have one and not the other, or vice versa, you can actually cause local sort of problems. And so in those cases, it might be very, very difficult to have some full restitution. And that's what I was talking about before with sort of managing our expectations. We might not expect a full restitution, right? We could probably expect some level of maintenance or prevention of further losses, which are really, really important as well.